My clinic has joined the Electronic Health Record Sharing System, eHRSS. Does it mean I can access the Electronic Health Record, eHR, of my patient who has submitted an eHRSS application online? If your patient has applied for eHRSS online or through other not-in-person means, you just need a simple step to access his or her eHR when he or she arrives at your clinic. Your patient only needs to bring his or her Smart ID card to your clinic. With the all-in-one function, you can activate the eHR for your patient and obtain his or her sharing consent easily. Once completed, you can access your patient's eHR through eHRSS to provide him or her with timely healthcare services. That's convenient. How does it work? The all-in-one function allows you to handle a patient's registration, eHR activation, and sharing consent on the same page. Besides quick and convenient, it's simple and easy. Your patient only needs to insert his or her Smart ID card into an eHRSS designated card reader. After selecting the patient's gender on the page, the system will retrieve his or her application. If the patient has already submitted an application by non-in-person means, his or her registration status will be displayed on the record activation page. Please verify the information with the patient, especially the communication means, to ensure all details are accurate, and update it when necessary. You can next obtain the patient's sharing consent, either for 1 year or an indefinite term, according to the patient's preference. When all information is confirmed accurate, click Next to proceed. Other than Smart ID card, is there any other means to activate a patient's eHR and obtain his or her sharing consent? Sure, you can input the patient's particulars into the system and print out a consent form. Check the completed information and fill in the effective date. Then ask your patient to sign on the form. Finally, remember to read and confirm the patient's verification checklist. Click Submit when done. To protect patients' privacy, please be reminded that all consent forms should be kept securely and disposed of 6 months after completing all procedures. In doing so, your patients can rest assured with their registrations. After completing the above procedures, a confirmation letter will be generated by the system. Please print it out for your patient's record. Then the procedures of eHR activation and obtaining sharing consent are all done. Your patient will also receive a confirmation notification through his or her selected communication means. Upon completing the registration or record activation, your patient's eHR will be uploaded to eHRSS for your access in about 30 minutes. What if my patient has joined eHRSS but yet to give sharing consent to my clinic? You can advise your patient to give your clinic sharing consent using the access key. How to use the access key. Every eHRSS patient will be issued with an access key. When he or she calls to make an appointment with your clinic, your nurse or registration staff can input the patient's personal particulars into the sharing consent page after identity authentication. Then select Access Key and input the patient's 8-digit access key to obtain his or her sharing consent. Alternatively, doctors may input the patient's access key in the eHR viewer directly to obtain sharing consent. What if my patient has lost the access key? You can simply click Generate on either pages to reset the key for your patient. The patient will receive a new access key through his or her selected communication means. Input the new key into the system and the sharing consent will be given to your clinic. Again, the patient will receive a confirmation notification through the selected communication means. After completing this one-off procedure, you can view the patient's eHR shared through eHRSS to provide him or her with enhanced healthcare services.